So the first thing I like to do is take a history. So I like to look at, I always ask things like when the injury happened, if there was any obvious trauma, if they felt anything go, if there's been any swelling or any other problems. Next thing I normally like to do, and I can do this normally when the patient walks into the room, is look at the gait. So that's the first thing I do. So Jake, do you mind walking to the end of that? So looking for any antalgic gait really, and on the way back, any obvious limping, anything like that which might suggest any pathology, and that looks fine. If you could lie down for me, please. Okay. So the next thing I do is look for any deformities, any varus or valgus deformities, any obvious swelling, or any rashes or any redness. At the moment, I'm not able to see anything. Maybe a little bit of swelling actually just on that ankle there, on the lateral aspect, just there. But actually otherwise on that, I think everything looks okay. So after inspecting, also, to be honest, at this stage actually, not only the ankle, I also like to inspect the knee, because obviously any problem, varus or valgus problems in that area can impact on the heel and the ankle joint itself. So after having a really good inspect, the next thing I like to do is palpate. So the first thing I usually do actually is just feel for temperature. And I'm not, if we're doing the ankle exam, so just feel over the ankle joint itself, any differences in temperature, which I can't feel. Again, palpating over the ankle crease there, looking for any swelling. And again, there may be a little bit of swelling just here anterior to the lateral malleolus on this side. Then feel the medial malleolus, always look at the patient to see if there's any pain in the lateral malleolus, and feel over the ligaments, the ATFL, and behind, see if there's any swelling of the posterior tibialis, and the other side as well. Sorry, the posterior tibialis is this side, and just around the ankle. So then I normally come down. I know this is the ankle exam, but it's always useful as well to feel the bony landmarks of the foot. So feel across the first MTPs, to see if there's any pain, and this side as well. Okay. The next thing to do is 3 minutes. The next thing to do is after it is movements. So firstly, do active movements. So if you do plantar flexion, so up towards you, please, and note the degrees you can do, and then down, please. So it's dorsiflexion, sorry, and plantar flexion.
3 minutes.
Okay, stop.